one of the things that's happened over the last few years is with the Affordable Care Act, we have seen some shift where a lot of folks who lived in at-risk communities, which were underserved medically, instead of seeking their primary care through the emergency department, they are able to often access primary care physicians. Taking the primary care from the emergency department to the internist or family doctor's office is critically important. When we look at what are the most important risk factors for stroke, high blood pressure is far and away the most important risk factor. Diabetes, smoking, high cholesterol, these are all critically important factors, which are all modifiable. We can do something about them. And if we look at what happens in at-risk populations that are medically underserved, there isn't as much access to medications or services unless they take this prevention approach by going to the internist or family doctor. When they do that, and they're able to get on the right medications and control those risk factors, they're substantially reducing their risk of stroke. And so this shift to being able to go to the primary care doctor is critically important to reducing stroke risk in those at-risk populations. Some of the things we really need to get the word out about is any amount of smoking is harmful to people. And there's been some studies that have suggested that lower amounts of smoking might not be as harmful. It's all a risk factor. I think there's a mistaken impression that by vaping certain products or by taking cigarettes through electronic cigarettes that we're keeping our risk low. And that's really not necessarily the case. There's certainly risk in vaping any product, and there's risk with electronic cigarettes. There's risk with any amount of cigarette or tobacco use. And when we look at control of blood pressure, it's not just going to the doctor, it's also taking your medication every day and staying on top of those issues. Cholesterol medications, a lot of the most important medicines are available in generic form, and so the reduced cost of or affordability of those medications means better control. Diabetes is quite a challenge because it requires good nutritional approaches, some exercise, and access to the right medications and care to control their diabetes. And at-risk populations still struggle quite a lot with diabetic control, which is such an important risk factor, not only for heart attack and stroke, but important risk factors for chronic kidney disease and other diseases which result in increased risk for the patient in general. People have to take responsibility for their health. But at the same time, if we don't have access to care, then we're not giving people the opportunity to take advantage of that responsibility. So if you take responsibility but you can't see the doctor, and there are people who live in areas that are medically underserved where there are huge wait times to see the doctor. And during those wait times, they may experience a significant change in their health. And again, the emergency department is not a good replacement for a primary care doctor. We need continuity of care. We need relationship building between the patient and the provider in order to maintain good compliance with the medical therapy regimen. So those things are really important. The access to medications, access to specialists is important. The responsibility is on the patient, but people are starting to take more responsibility for their health care. I think when you have more access, you feel more empowered to take care of your health care. When you don't have access, you feel less empowered and wonder, what am I putting the time into when I can't get in to see the doctor or get the medications I need?